Hey everyone, today we will carve right first molar tooth. First of all, it's the biggest tooth in the mouth. So we will use horizontal of the saw, but you can also use vertical. Important thing is ratios here. Also, occlusal morphology is very important on this tooth. So first of all, I will give you measurements here. Molar's length will be around 3 unit, mesiodistal 4 unit, and also buccolingual thickness will be 4 unit as well. First we will draw buccal view here. Mesial is a little bit flat and distal is more curved, more convex here. You can draw this according to the measurements. In the mesial view, we draw it again like this. Lingual face is more convex and buccal face is more flat. Then we cut. Also, like we said, crown length is shorter than mesiodistal width, so we have to cut from here. We haven't used measurements here. You can use this ratio and carve your tooth better than this. Our stone model on the video is bigger than our saw. You can see from the left side here, you can do the same carving like the stone model. Now we will round the corners and then we will continue with occlusal morphology. The most important thing is here on occlusal morphology. It's a little bit hard, but it will get better with practice, of course. As you see, when you look from occlusal, mesial side is wider than distal part. So we have to cut distal part a little bit. But also you can carve with your wax knife. Crown gets narrower to the distal. This tooth has 4 developed and 1 little tubercle. Fifth tubercle is called carabelli and located on the lingual of the mesiolingual tubercle. So there is a 4 main tubercle and 1 half tubercle, you can say, fifth tubercle, carabelli. We will mark each tubercle. Here mesial tubercle is bigger, mesiobuccal tubercle. This tubercle is smaller. On the lingual side, you can see mesiolingual tubercle is very big. So it has to be bigger than mesiobuccal tubercle. Mesiolingual and distobuccal tubercle triangle ridge comes together and form a ridge which passes over the occlusal surface obliquely. This is called oblique ridge. It's a very important structure on the occlusal morphology. You can see oblique ridge here from mesiolingual tubercle to the distobuccal tubercle. So here oblique ridge and carabelli are the most important structures on the morphology. We will carve slowly here to create tubercles and oblique ridge, of course. On the palatinal view, lingual developmental groove starts from the center of the lingual surface, separates it into mesiopalatinal and distopalatinal tubercles on the incline through the distal. Mesiopalatinal tubercle is the biggest and the longest tubercle. It forms 60% of the lingual surface. Keep carving the occlusal morphology and get deeper. Also, you should protect oblique ridge. Don't overcut from oblique ridge. You can see here, half of the oblique ridge almost form all of the distobuccal tubercle. There are two big fossa, central and distal fossa, and two small fossa, mesial and distal triangular fossa. Time to time, clean occlusal with a sponge. After finishing occlusal morphology, adjust the cervical area. Approximately 1/3 cervical area gets narrower to the cervical line. From 4 aspect, draw cervical line. Then last touch for the buccal and lingual. When we look from buccal, two tubercle can be seen from buccal view. Mesitubercle is wider than distobuccal tubercle, but the distobuccal tubercle is taller and sharper. Developmental groove located on the buccal surface separates two tubercle. Now we will create here Carabelli fifth tubercle. Carabelli tubercle separates from the tubercle with a mesiolingual groove. Now we will carve this groove. This Carabelli tubercle is not functional. The other 4 tubercle is functional tubercles. Main eye carving is finished, but I think you can carve better. Here we have Carabelli fifth tubercle on mesiolingual. This is the biggest tubercle here, mesiolingual tubercle. And near to the oblique ridge, there is a small tubercle, distolingual tubercle. Mesiobuccal tubercle is wider and bigger than distobuccal tubercle, but shorter than distobuccal tubercle, of course. But on the stone model, it's almost same. And there's a slight developmental grooves on the middle of the tubercles. You can see from the SOP model. Then we will use socks and Satan to polish it better. Hope you enjoyed this one. Good luck while carving. See you in the next video.